Hello, everyone. Nice to see you. Happy day after Thanksgiving. I'm Christina Ruffini. Vlad and Anne-Marie are off today. A new dangerous COVID-19 variant detected in South Africa has sparked global fears as cases appear to be rapidly spreading in parts of that country. Scientists say the variant is now mutating and affecting many young people nationwide. The World Health Organization is expected to address these latest developments during a high-stakes meeting later today. Meanwhile, Japan, the European Union, and other places around the world are implementing stricter quarantine measures and looking to ban flights from South Africa and neighboring countries. Debora Patta has more from Johannesburg.
The variant was detected in the last few days because of a jump in new cases near Johannesburg. While numbers are still low, just over 2,400, they doubled overnight.
This is familiar ground for South Africa, a new variant that has once again sparked fears that it could set back the fight against the pandemic. The new variant marks a huge jump in the evolution of the virus since the global health crisis began. The concern, it could be more transmissible and more resistant to vaccines, says public health expert Professor Salim Abdul Karim.
If this variant is as or more transmissible than the Delta variant, it would be very difficult to anticipate it would do anything different to what we have seen with Delta, which is that it would grow and spread across the world.
South African scientists are now working around the clock to determine just how bad this new variant is. Lab results are still a few weeks away. But many countries are not waiting to find out, with several cancelling direct flights from South Africa overnight. The new variant has largely been detected amongst young people who have the lowest vaccination rate in the country. Karim stresses it was picked up here first because of South Africa's excellent variant surveillance.
And it is true that other countries that may not have the same level of diligence may well have new variants spreading, either this one or others. They just don't know about it.
Karim stresses that even if current vaccines are less effective against this variant, they will still provide some protection against serious illness and death.
Debora, thank you. For more on this, we want to bring in Dr. Ron Elfenbein. He's the medical director and owner of FirstCall Medical Center. Doctor, first of all, good morning. And also, how worried should we be here in the U.S. about this new variant, they first found in South Africa?
Good morning, Christina, and happy post-Thanksgiving to you and your viewers. I think we should all be concerned. I think worry is a strong word. I think before we know more about this, we should be concerned and we should follow the news, but I don't think we need to panic. The World Health Organization is meeting today to discuss it. We don't know at this point if it's, as the package just before had suggested, we don't know if it's truly more transmissible, and we don't know if it's more deadly, and we don't know if it's more infectious. So I think until we understand that, it's all just conjecture. Obviously, again, we should be following what's going on in the news, but I don't think people need to panic at this point.
Now, researchers in South Africa are trying to reverse engineer the Moderna vaccine to tackle the spread of COVID in that country. What exactly does that mean, and could it help halt the spread of the virus in developing nations?
Yeah, it's actually interesting. So if you think about the World Health Organization estimates that only 0.7% of vaccines have actually been shared with the third world. So they are woefully underrepresented when it comes to vaccination status. So they've basically taken it upon themselves to try to reverse engineer or steal basically the vaccine. They asked Moderna if they could start producing it themselves, and Moderna had said no. So what they're trying to do is essentially sequence the messenger RNA in the vaccine and then produce it themselves. The reason they chose Moderna is because it's the Pfizer vaccine is much more difficult to store. Remember, it needs to be stored at minus 70 degrees Celsius, and a lot of places outside of major academic institutions do not have the capability to do that. Certainly not in most third world countries. So the Moderna vaccine is a natural one to.
So, you froze for just a second there, but we got you back.
Oh,
sorry, go ahead.
Sorry. Can you hear me?
That's okay. We can now. The wonders of modern technology. You think after the pandemic we would have gotten this down, but we're still working out the gremlins. Where do you fall in this argument with a lot of Western countries, including the U.S., now recommending booster shots, a third shot, when so much of the third world hasn't even gotten their first shots. And are these Western countries doing a short-term benefit for a long-term disservice if the virus is allowed to run rampant in these countries and eventually creates more mutations that then come back and are immune or could potentially be immune to some of these vaccinations?
Yeah, I was actually going there before I froze. I think if you really want to stop the spread of the virus, obviously there are certain vulnerable populations in the United States that should be boosted up, and those are the people who are most at risk of dying and or needing hospitalization. The elderly, the people with serious comorbidities. But that's really it. You really don't need to be giving a booster shot to a healthy 20-year-old at the expense of people in the third world. And I don't say that purely out of altruism. I say that because where are most of these variants popping up? They're not popping up in Seattle or in New York City. They're popping up in third world countries. So if you want to stop the spread of the virus worldwide, the way to do that is the United States should take the leadership role and should call a meeting of all the major Western powers and say, we are going to put billions of dollars towards this, and we are going to provide vaccinations to every single country in the world that cannot do it themselves. And we will use the U.S. military and all of our every bit of resources at our disposal to get this done and to vaccinate every single human being on the face of the earth. That would stop the spread of the virus. That would stop all these variants popping up, and that would put an end to this pandemic. But without that, I don't really see that happening. And again, with only 0.7% of vaccines being shared with the third world, I don't see that ever occurring. So I think the key is to get into these countries that can't do it themselves, help them, and get these people vaccinated. And that would, you're still going to have coronavirus floating around. It's not going to go away, but you'd end this pandemic and you'd end what's going on in the world right now.
Well, and even in the U.S., where a lot of people are vaccinated, we're still struggling. And one of the ways states are trying to mitigate that, I know Maryland has started offering free rapid testing. How important is that? And should more states be rolling out, free testing, free ways to know your status amid this surge in cases that we're seeing here in the U.S.?
So I'll tell you, I'm a little bit biased because I own a facility, an urgent care. We have 7 testing centers, and we've tested over 600,000 people already. So I would say that I think it's a terrible idea that in Maryland in particular, what they've done is they've taken at-home kits and they're giving out 500,000 at-home kits. They also rolled out a program with CVS where you could drive up to CVS and they would hand you a test and you'd swab yourself. And the reason I say it's a terrible idea is because anybody who's had a COVID test knows that it's a very uncomfortable procedure. You take a big stick and you shove it up your nose. Basically, that's what it is. It's very uncomfortable. It's quite painful, actually. And nobody is going to do it properly on themselves. I wouldn't even do it properly on myself, and I'm highly trained on how to do it. So I think the government should be providing free tests. And in Maryland, at my centers, we don't charge patients for the tests. We bill their insurance so that they have no out-of-pocket costs. I think that's the way to do it. But I don't think that sending people with kits at home or relying on them to test themselves is a smart way to do it, because what's going to happen is nobody's going to do it properly, and they're going to get false negative results, and they're going to have a false sense of security, and they're going to go out and potentially spread it. If you don't feel well, you're going to say the first thing is, I got to go get tested. Well, here you go. It's a free home test. Let me test it at home. I swab myself. It's going to be negative because I'm not going to shove it far enough up my nose. And then I have a false sense of security. And I say, I can go to the grocery store now, or I can go hang out with my friends. And I do that. And guess what? You just spread COVID. So I think it's a great idea that we provide testing to the public. I don't think in this country we have enough testing, but I don't think it's a good idea to do self-testing.
All right, Dr. Ron Elfenbein. So maybe more testing, but proper testing, and not relying on people like me to shove Q-tips or swabs up their nose properly. I think that's probably a good bet. Thank you so much for being with us.
Thank you. Happy Thanksgiving.